so now we're moving into the information gathering part of the consultation. Obviously the rapport stuff carries on. Okay, so I'm going to ask you now some questions to find out a bit about you, so that I can give you the best massage that I can today that meets your needs and fits with what you want. Okay. Everything that you share with me is confidential. Okay.
Yeah, sure.
So first of all, have you had massage before?
I have, yeah.
Okay.
Yeah.
Okay. And of those massages before, which ones have worked best for you? What kind of work?
I prefer the massages with oil.
Mm-hmm.
I've had Thai massage before on the floor,
Mm-hmm.
but I felt a bit bruised and battered afterwards.
Okay.
I tend to change the type of massage I want depending what I need. And
Yeah.
today I definitely just want some TLC, so
Okay.
the holistic massage really is what, really excited about having that today.
Okay. Could you tell me a little bit more about, you said you had an injury when you were away. Do you want to tell me a bit more about that and a bit more about your achy shoulders? If there's anything more specific to tell me about those things.
Yeah, sure. Okay. So I was away on holiday and I was in an accident.
Okay.
I ended up breaking my radius on my right hand, right arm.
Okay.
So on Christmas Eve I had surgery, so I've now got a metal plate in there.
Okay.
And 6 screws.
Wow. Okay.
But I've been for a checkup over here and I'm recovering really well. So I'm not so worried about it. I'm just gradually using it again. Okay. So I wouldn't want much attention on here at all, really.
Okay.
So yeah, that's the update with that. But it was a bit of a shock for me and everything that went on with it. So
yeah,
I think to have a bit of nice attention on my body rather than
focusing on where you've had the injury.
Absolutely, yeah.
Do you feel there's been any sort of other muscles compensating as a result of the injury?
Maybe I've been having to use my left arm a lot more. So I was out of action in terms of using my right hand at all for probably about sort of 3 or 4 weeks. Okay. So my left hand had to take over. Okay. So maybe I think that's probably why I'm feeling quite a lot of sort of tension up here.
Just adding to that sort of tension you also described of coming back into the cold.
Into the cold, yeah.
Okay.
And not quite being ready for it. Yeah. So it tends to be kind of upper body, up around my neck and sort of top of my shoulders. That's the main area, but maybe because I'm lower back as well. Okay. Just because I'm feeling that's kind of asking for some attention as well. Nothing too desperate, but
yeah, as part of the TLC.
Yeah, exactly.
Okay.
Yeah.
And are there any other areas where you feel your body tends to hold tension, sort of pre-accident, everyday life? You know, is there anywhere else that you would?
Yeah, I'd say that my right glutes, I tend to stand, and because of my work, I can be sort of bent over in awkward positions sometimes. So sort of my right glutes and hips around here, I tend to kind of do this a little bit. So it might be up here and in here. Yeah, that's a pocket of tension.
Okay. What, do you mind me asking what your work is?
Yeah, I'm a massage therapist myself as well. Yeah.
Okay. So just a few questions about more general stuff. Do you sleep? How is your sleep patterns? Do you sleep well? And how are you sleeping at the moment?
Yeah, no, it's pretty good actually. I'm sleeping. Got used to kind of coming back. It's been a week since being away, so I'm back into sleeping at the right time and getting up. So yeah, no problem.
Okay. And digestion?
Digestion's a bit tender actually. I suffer with IBS on and off, and the different adjusting to the different cuisines from being away in Sri Lanka and coming home. So actually I'm a little bit tender in there, and the stress, it goes straight to my tummy as well.
Okay.
Yeah.
So it all adds back into the sort of relaxation.
Yeah, absolutely. Okay. Yeah.
Anything else around your general health that you feel that would be useful for me to know? Things like, are you taking any medication?
No, I'm not at the moment, no. I was on quite strong painkillers probably about 2 weeks ago, but I have now if anything kind of aches or use my hand too much, it'll just be a paracetamol or something.
Okay.
So yeah, nothing dramatic really.
Okay. And things like blood pressure, heart problems,
No, all
deep
fine.
vein thrombosis, anything headlining like that?
No, all fine, yeah.
Okay. And anything in your history, sort of accidents or operations that you feel I need to know about?
No, this is the first and main one actually. Yeah.
Okay. That's great. Thank you very much. I think that's probably enough practicality, enough information